Welcome back. This is Newsfile. It's your most authoritative news analysis platform. And here on Newsfile, we put Ghana first. And my guest in the studio, happy to welcome right from my immediate left, Professor Sharif Mahmoud Khalid. He's economics advisor to the Vice President. Next to him is Dr. Justice Youngson, lawyer and former General Secretary, the Ghana Medical Association. Next to him is Suleimana Brahima, Executive Director, the Media Foundation for West Africa, the group that blew the whistle on the National Service payroll scam. And then Andrew Ejapamesa is lawyer and former Member of Parliament for Second D. He was also minister in two different portfolios. We'll be joined online by Samuel Alakora Kolgo, who is First Vice President, Ghana Registered Nurses and Midwives Association, and Mary Awalana Ada, who is Executive Director of the Ghana Integrity Initiative, the Transparency International Ghana. Now, thank you all, ladies and gentlemen, for making time to join us this morning. So let's begin with the nurses. It's obviously not over because they say that they are going to be watching and ensure that things are done right. Otherwise, this suspension that brings them back to the wards today will be resumed. Let's listen to some of them. Right. Okay, so let me start this way. Dr. Jansen.
Yes, Jansen.
You must be tired about these discussions, right?
It's really so.
For your own, as you know, physicians, and then those who support you. We've had you on this show a number of times having to deal with these matters. Were they right? And are they still right in insisting on what ought to be implemented?
Let me start this way. It's a very dicey issue, depending on how you look at it. There's a very thin line between what one will consider right and what one will consider wrong. If you are in the shoes of labor or the nurses, you appreciate the fact that they are very right. However, if you're on the other side, you may think that, in quotes, they don't have empathy, they are causing people to suffer and all of it. But as we say, the devil is in the details. The moment you go into the details proper and see the trajectory that they may have traversed up till today, the nuances, the discussions, the disagreements and all of it, then you begin to realize that no, we need to pause, have a good and critical look at their issues and resolve them for the good of all.
Must it always get to this, 11 days of a strike?
To be honest with you, ideally it should not. From where I sit and the experience I've had in the labor field for pretty close to 20 years dealing with some of these issues, I'm very clear in my mind that most of the time, labor gets to this point as a result of the seeming inadequate engagement between the employer and labor. I realize that in most cases, the workers give enough room, sometimes years, to the employer to do what is right. And it gets to a point they are forced to take actions like this. And unfortunately, when the actions happen, the engagements sometimes don't even improve for days before they come to the table and say, look, let's look at things properly. And within hours to maximum a day, or sometimes two, the issues are resolved. So I always ask myself, why do we wait till we get to that end? I can use my own group's example some years back. We were on strike for almost 3 weeks. Now, Samson, it will surprise you that it prolonged to that length because at some point, there was a certain directive from some higher level that don't engage them. So for a whole 1 week, there was no communication, there was no attempt at resolving the issues, but rather all sorts of insults, all sorts of foul language being unleashed on my group from political actors, their, foot soldiers and what have you. And these things rather tend to escalate the problems. I remember once we were called by a minister for a meeting. We had a call somewhere around 9 p.m. We get to the ministry in the morning by 8. We wait for about 2 hours. The minister appears. And this is somebody we had engaged previously, days before, or even the previous day. And like I said, he called us at 9 p.m. So we were in touch. He sees us. He refuses to greet us, walk past us, get into his office. We're all baffled. We wait for a while thinking he was going to come back. He didn't. We went to the conference room where the meetings were going to be held. After a while, we decided to see the chief director. Whilst we were going, we realized that he was also walking out through another door. Not the chief director, I mean the minister. And honestly, after we engaged the chief director, I wouldn't want to disclose whatever he may have said. We left and everybody was bitter. And this was the highest level in terms of the leadership of the association.
Hold on briefly for me. Samuel Alakora Akolgo is the vice president of the Ghana Registered Nurses and Midwives Association. Thank you for joining us. Is it similar circumstances as narrated by Dr. Justice Jansen that has brought you to a strike for 11 days? Please unmute your mic, sir.
Thank you very much, Samson, my brother, and then my co-panelists, especially my big sister, Mariada, and then to our cherished viewers and listeners. I think my network went crumbling a bit, but I heard the initial part of Dr. Jansen's submission. Yes, sometimes when you are leading people, the people expect that you will go and articulate their views to whoever that is supposed to respond. Now, if you go to present their case, in our case, our employer, it is expected that something measurable should be given to the leader so that he can carry it back to the people and said, in the discussions, this is where we have reached. But if that is not forthcoming, and you know human beings, the conspiracy theories are many. Oh, the minister is their friend. They just go and then they are deceiving us. So it will get to a stage where even the membership doesn't believe whatever you are saying. And when it gets to that point, there is so much pressure on you to demonstrate that you are really committed to their welfare.
So did you exhaust the engagement? That's the question.
When you say exhaust, it is, there is nothing like you have exhausted the engagement. Whether the engagement were bringing out something that we can take away and go and present to our members. That is where the issue was. And for the minister, he was available for us all the time. When we strike a meeting with him, he's always there. But in the meeting, it is just pure assurance. Trust me, I will do it. You can't go and tell your members that the minister said we should trust him.
Tell us this. How did you come to the point of declaring a strike? To have in excess of 120,000 nurses on strike, about 70% of the nurses in this country.
Yes. As in our earlier discussions, we started engaging the ministry since January. were told we should hold on till the government structure is put in place. And at that time, our chief director then was always in constant engagement with the chief of staff who was at that time already appointed. Now, we waited, the ministers were appointed, vetted, the budget was read. So when they appointed our minister and we met him, he said, oh, we should just give time, they will read the budget. Then we waited. After the reading of the budget, we went back. There's pressure on us. Let us see how we can resolve this matter before it moves out of hand. The minister continued to tell us that he wants us to trust him. And then he felt we were just being unfair to him because he was new in the ministry. But that was not the case. People we signed the conditions of service with, that is the other health professionals in the health sector, and are enjoying their own. So why should that of nurses and midwives continue to delay?
Right. So if I may ask this question then. So these demands that you were making, 13th month salary, 1,000 annual uniform allowance, 180 liters of fuel, 8% non-basic allowance, government-funded license renewals. You had been giving the impression that your situation will be captured in the budget. Now we are told that it will cost 2 billion if this has to be done, and that has not been factored into the budget. Does that sound like a betrayal to you?
It is, because we're told we should wait for the budget to be read before. So how come that it was not taken on board? And if you heard the news conference that was organized, and these are some of the things that makes our members very angry. The government spokesperson said at the time they were making the budget, the conditions of service were still under negotiation. That is factually inaccurate. And we're expecting that before he could even speak to those issues, he could have gotten hold of the document, which is readily available. It is now everywhere. We didn't even want this document to get into the public domain, but it is everybody is now having it as newspaper.
But the conditions of service had been agreed to by a previous government, right?
Yes, please.
Okay, so you will understand that they really meant it when they said you should give them time because you were rushing them. They had just come into office.
You see, if they had given indications from the beginning that there was going to be a challenge, in that case, we wouldn't have been going to our members to give them assurance that, look, let the government set itself finish. Let them read the budget. But why should we talk about the durations of the government? Are we saying that since the government came in, they have not expanded in other sectors or in other areas? It is only the nurses and midwives' conditions of service. That is the only one that our employers feel they cannot implement.
Okay, Mr. Akogo, so now you have suspended the strike. A lot has gone on, which may have been unnecessary. If somebody had lost their lives, all this would not have been important. Now, you are scheduled to have a follow-up meeting on the 26th of June. What must happen on the 26th of June for you not to resume the strike?
Thank you very much once again. And let me use this opportunity to thank the Parliamentary Select Committee on Health, and then more especially the majority leader who joined the team and were able to come out with something fruitful. We put out some understanding, and the understanding was we put them in the hierarchical order. It became clear that we're not going to get everything this time, but something will come out of it. The rest will be implemented next year. Now, to tell you the sacrifices that we have made as leaders for the sake of the country, there would have been arrears from July 2024 to date. We have decided not to bring the arrears on board and just start and move forward so that we will not have the issue of backlog of money to be paid. So if the people of Ghana are listening to us, that is how reasonable we are. That is how compassionate we are.
But Mr. Kogo, you brought this upon yourself, didn't you? Because your other colleagues managed to get theirs and they are enjoying it, except your group. Was there not a court process that halted it?
Of course, yes. But the court process truncated through out-of-court settlement, of which the judge adopted as the court adopted as its judgment. And in January, we had applied for the judgment and distributed it to all the institutions that were being prohibited from implementing the conditions of service, because the documents was already in the Ministry of Health and Ministry of Finance. Fair wages and salaries also have their own. In our own way, we made a follow-up even up to the Ministry of Finance. They were going to sign it just like the other unions own that they have signed, but for the court order. Now, these are our own members.
I need to get to the studio and speak to my other guest on the program. I wanted you to be direct with me. The government says there is a need for 2 billion to be able to cater for you. That has not been catered for in the budget, so you must wait for 2026. Do you think this is going to change when you hold the next meeting on 26 June?
We believe so.
If it doesn't change, nothing will persuade you not to resume the strike?
We don't want to speculate because the honorable members in the Parliamentary Select Committee on Health are honorable men of integrity. And we believe whatever understanding that we had, they will not renege their part of the bargain. We are not going to contemplate of resuming, whether to resume or not to resume. It is better we remain positive and hope that the right thing will be done for nurses and midwives so that they can continue to offer the nursing and midwifery services to the good people of Ghana. So we are not going to prejudge what will happen.
Isn't this what you should have done instead of going on a strike for 11 days and causing so much problem?
The strike it is the strike that brought in the Parliamentary Select Committee. It is the strike that made everybody in the country to understand the frustrations that we went through. It is the strike that made people to actually take time to listen to the issues that we're talking about.
But you are also an essential service provider. There are rules about how to go to strike. And as we understand, you broke the rules. Why do you do that?
You see, these essential service providers, that is the law's prescription. But the law also provides that our matters should be dealt with in alacrity. when you are in essential service, it is expected that the employer should even be asking you, are there issues that we can deal with so that there will be industrial peace? We just don't pick one clause which forbid us from going on strike to emphasize on that and relegating the other provisions. What is the law saying? If there is a dispute, it should be resolved within 3 days. If that fails, any of the party can refer the matter to the Labour Commission. And at the end of it all, in this case, we wouldn't have expected the Labour Commission to say that we should go and renegotiate the conditions of service or do otherwise. What the Labour Commission, if they wanted to be fair, was to tell government, no, tell them we can do A, B, C, D, and bring it, let's discuss. And from there, we move on. We have a country to run. We know resources are limited. But where it gets to a stage where people look at our numbers, when they take their calculators and they do pa, and the figure comes up, then it's like, oh, we can't. If you think we don't need that number of nurses to run the nursing and midwifery services in the country, let us know. Because you can use our numbers to.
But you are the same who continues to. You are the same who continues to appeal to government to employ more nurses because some have finished, they are sitting home, they have nothing to do, and so on and so forth. But my final question to you, in some 30 seconds, you suspended this strike not because there's a court injunction that you ought to have obeyed, but because Parliamentary Select Committee intervened.
All the factors are inclusive.
All right, thank you very much. Samuel Alakora Akolgo is the first vice president, Ghana Registered Nurses and Midwives Association. And forgive me, it's unpardonable that I seem to have a little struggle pronouncing your second name because we're from the same place. I was going to ask you when last you went home. I can demonstrate to you that I can pronounce it perfectly. Alakora. Yes. Yeah. So, Ejapa.
Yes, my brother.
As you can hear, the fact that they are an essential service provider, I will invite Dr. Yankson because I think...
Solidarity, yeah.
No. I think they may have been guilty of the same thing before. They are essential service providers, and yet they don't follow the law. They just strike when they want to because they know that, once they strike, they'll get what they want. And as it is, they are suspending it, not because there is an injunction by the Labour Commission, but because Parliamentary Select Committee intervened. And the government says 2 billion not budgeted for unless in 2026. Do you think they can be hopeful?
Samson, let me first and foremost start by extending my greetings to my colleague panelists and to our cherished viewers and listeners. Indeed, it cuts both ways, right? Essential service workers. But if the rule also requires government to act in a certain way and they don't, I don't think that going to equity necessarily will mean that, you can go with dirty hands. You ought to go with clean hands. And so we need to look at it and situate the expectation.
When equity is not done to you, you break the law.
No, that's not what I'm saying.
Okay.
I'm saying that we need to look at the issues and situate the expectation from both ends in the proper context so that we do not get situations like the one that we had over the past 12 or so days, which, as far as I'm concerned, was needless. We should never have gotten there. I, in my view, think that government was insensitive. They were just callous. They were dismissive of the issues and nonchalantly handled the entire matter. Not surprising because they go to private hospitals, right? And when push comes to shove, they are shipped off to Europe to attend better medical services. So the people of Ghana necessarily ought to suffer, and the kind of posturing that you saw government officials put up government communicators went out insulting these nurses as if to say they were at fault, when indeed, and in fact, it was government that refused to capture the provisions that have been agreed on as far back as May 2024 in the 2025 budget. It was nobody's fault. And if you listen to the Minister for Government Communication last few days when I heard him on a show with Evans, I was surprised that he says that they were protecting the economy. You put the economy over and above the lives of Ghanaians who potentially can lose their lives when strike actions of this nature take place. Listen to the Deputy Minister for Finance. They cannot accommodate 2 billion. They put the economy in disarray. Seriously? So people should die? Is that what the government of Ghana is telling
retired
its
nurses?
people?
Retired nurses may help.
Nobody came to.
You're calling on retired nurses to step in when the duty to make provision for these sums. And look, Samson, many a time we are quick to pass the buck that, oh, it was negotiated by the previous government. What does it mean? Is government not a continuum? Is this a policy that you can elect not to comply with when the government of Ghana has agreed with the nurses that these terms and conditions ought to be applicable to you? And so really, I think that the posturing of government in managing this whole situation was not done properly. Thankfully, we all have to acknowledge the role that the Health Committee of Parliament, as you know, the stakeholders are all claiming, have done exceptionally well in bringing this matter.
What do you think government can do since they did not capture this in the budget?
They have a media budget coming up. What mattered to them, okay, the compensation budget of the presidency was increased from 300 million plus to 2.7 billion in the 2025 budget. So it's a question of priority. If they prioritize the nurses and midwives, they should have made provision in the budget to ensure that we did not get to this point. But clearly, of no consequence as far as they are concerned. They thought they could treat them anyway, to the peril of people who received services from these health institutions. I think it's very unfortunate. And I don't think that the government was right. They should apologize to the people of Ghana for the way and manner that they've handled this matter. I'm sure people lost their lives during the period that the nurses went on strike. And we cannot, under any circumstances, countenance these matters. Okay? Recall. I'm sure you are very familiar with the phrase, the economy we know how to bring back. But when we lose human lives, we've lost them for good. That was an empathetic decision that the government took at the time when we were faced with the pandemic, that will go to all expense to protect the Ghanaian people. It came with economic consequences. They harped on it and described Akufo-Addo government in words that I'm not prepared to repeat them here. They called the government all sorts of names for taking a decision to err on the side of the Ghanaian. The president was very clear in his mind. He could have also elected that, hey, we do not have any budget for COVID-19 expenditures. And so those who are going to die should die, come hell or high water. But that's not what the response of the Akufo-Addo government was.
But that's an entirely different example.
It's a question of choices.
You've heard that
COVID-19
was more or less a blessing in disguise for this country because of the money we got for it.
Of course, we borrowed money to fund COVID-19 expenditures. No,
okay.
We got grants, but we borrowed money to fund COVID-19 expenditures. But if the government takes the position that nurses strike, government not backtracking, we are protecting economy from collapse, then you put in the protection of the economy, the financial cost of paying for what you have signed on over and above the lives of Ghanaians who potentially might die during the period. You think it's right for government to take that position? And I'm asking you, if Akufo-Addo had adopted that same position in 2020 when the COVID issue came up, what would have been our response? Of course, that decision came with economic consequences. It led to the restructuring of our debt. It led to the debt exchange. it led to us going, of course, you can shake your head, but the truth of the matter, or unless, of course, you are not making reference to me. Okay? When that matter came up, we had issues. But if that matter hadn't come up, we probably would have been able to manage our issues better. The energy and banking sector, COVID came to compound it. Okay? But the government, because it was empathetic, took the decision that it was going to put the lives of Ghanaians first. Is that what Mr. Mahama's government has done in respect to this matter?
Right. So as far as you are concerned, this is self-inflicted?
Certainly.
And
because they had an opportunity.
It was a question of priorities?
Certainly.
And therefore they should fix it now?
Certainly.
With the
mid-year review budget. They should. They should make
that comes
provision.
up when? That comes up
in July.
In July?
Yes.
Okay. What do you say, Prof?
Okay, Samson, thank you very much. And as we talk about public education, among other issues, with all of these issues, and also with, you keep referring to me as Prof, and that may be a bit distractive.
Prof in the classroom, so you doc. Yeah.
Yeah, because the point is, I come from a different jurisdiction.
That's right.
I was working in the UK, where we interchangeably have associate professor analogous to senior lecturer. That's how we do it, because then when you go up the ladder, you don't really go through, or even within certain institutions, you don't even have associate professor, you move straight to chair. So when you are in another jurisdiction and you tend to use these things interchangeably, they may be destructive to the course I do, because I've had a sterling academic.
So I should simply keep
Sharif is fine,
right,
it's fine.
okay.
That's my first name. I'm not big on titles.
Please, PhD is difficult to get. It's a lot of time. So if you earn it, and it's not honorary.
When you do a proper PhD, right after your viva, you forget what you
see. Because you get tired.
Yeah, you get tired. Look, I graduated 5 PhDs in my entire academic career before coming. And
really?
I've not worked less. I worked in Russell Group universities throughout.
That's right.
So when you have a sterling international academic performance, you come to jurisdictions where there could be difference and controversies. You try to manage that. Let's get straight to the topic. Right.
It actually intrigues me. I don't know why anybody gets up. You want to put a PhD on yourself. You don't have it.
Yeah.
But what is this? You have not sat in a classroom. Do you know what it takes to do, like they call it, foundation lectures for 2 years? Do you know what it means to write to do your comprehensive, even before you become a doctoral candidate? You just gotta pick the title. You get an honorary one, you're hanging it on your neck, and even insisting that people should call you by that name. And when we say watch out, you say people are idiots. Yeah. I think the president should deal with computer.
Okay, so to the very germane topic which we are on. I mean, labor unions have, since time in antiquity, been existing for a while now through medieval time, among other issues. At some point in time, they had a lot of struggle in actually building the momentum that we have today, which has actually solidified them to where they are. And you know that in the Industrial Revolution, they became a very strong force because of labor essence and the demand for labor. Now, the very famous Haymarket Affair of 1886, which led to May Day, which is Labor Day, tells us how far and to the extent to which labor unions have come this far. But there are different kinds of labor unions where we have essential service providers, among other issues. Then we have health, right? So when it comes to health, it becomes a very sensitive issue, especially so given the services. And I'm sure Doc would agree with me. He has been a unionist, he has been a lawyer, he's a lawyer and a doctor at the same time. So I don't know which one he wants to go with. But you would realize that these are very critical issues that come to the fore. But where I come from, having been a member of government, is that we've come far from a very difficult economic position in the last 1 year or so, where, if you look at our economic dashboard, it was quite messy. You had a central bank posting losses, you have a domestic debt exchange program, you had blue chip investments such as pensions that have been touched, among other issues. So we really had a very overheated economy that is yet to even cool off. So if we are coming from the back of this, and we have been greeted with a very important issue such as this, the only way we can have a strong solution is to come to the table and have a jaw among ourselves, which I think that if we hadn't really had this jaw approach, we would not even be where we are with the strike action. Now, when you look at all those that are experts in labor union agitations, among other issues, right, you'll realize that they strike where it hurts most. So you even see the short-lived action that the nurses took, the OPD, which is a critical operations of a health facility, was affected for 5 days. And cumulatively, we had an 11-day action. But in all of this, I don't want us to look at it from a political lens. We have to look at it from a practical economic perspective, an economic lens. And that economic lens is where I am coming from, which is the economic history for the last 1-2 years to which we have come from. I mean, examples of COVID-19 could be made, but we all know the support we got internationally from COVID-19. We're not going to get, if the British institution could give us grants to pay doctors and nurses, why not? We'll take it with 2 arms. But that's not going to happen because this is hardcore labor issues and no agency is going to come to our aid as had happened in COVID-19. So we could give a lot of examples as COVID-19. We could laud words like the government being insensitive and callous, but I don't think that is what it is because it is a real engagement of the reality on the ground. I mean, a wage bill of 2 billion. This is what the Deputy Finance Minister said. Look, it's not like we're not going to do this at all, right? Can we have some respite? Can we negotiate and see what we'll do? And looking at this, there could be a clear agreement that, you know, where you don't have any payments or disbursements to be made, such as the COS issues, could be addressed. Then can we defer most of these payments to possibly 2026? These are examples I'm giving, by which time the economy might have, you know, bowed because we're doing a lot of work around it. We're having currency stability at the moment. We're winning or getting some gains as far as the economic stability is concerned. So when we get this, we could do that. Or possibly, if the economy does greater or better, right, before mid-year review, we could accommodate that as well. So these are the very fundamental issues we need to talk about. But to make examples of apple and oranges, as in allocations to government agencies that has been inherited and need to have actual salaries, not allowances, right? So the ISD, the Ministry of Information, among other agencies that the presidency inherited, that ought to have wages. Should we stop their wages at the time of inheritance? So why do we make government allocations or legitimate allocation of funds to these agencies an issue that we have to compare to this and say, okay, someone is being looked after? As we speak,
that point you just made is an attempt to explain what Ejapa Mensah spoke about, that the presidency has increased its budget by over $1 billion.
It is not the presidency.
When it was, that's what you explained.
Yes,
is that it?
That's what I'm explaining. But it's not the presidency increasing its budget.
Because, what do you say is the
I said we have agencies that has been inherited by the presidency that ought to have emoluments being paid. They ought to have end of service benefits being paid, among other issues. Where is this funding going to come from? So if that allocation has been made, I mean, you and I know that Article 71 office holders and other people that work around the presidency, after they leave as well, they have to get some benefits.
So that's why the budget for the presidency has ballooned.
I am giving examples of inherited or legacy institutions, right, that have been added to the presidency or that are under the wing of the presidency. When you say presidency, people just see it as an edifice of the Jubilee House. But it has a broader expansion of other key agencies that surround it, which you know, and the public knows. So when we keep giving that example and try to, compare it to a critical matter such as health, it may not give, positive oxygen to the debate.
But like Mr. Akulgu said, they had met the minister. Initially, they were told, we just came into office, give us a breathing space. Then a minister was appointed. They approached the minister. The minister says, wait for the budget. That was sort of an assurance that it will reflect in the budget. Then the budget comes, they don't find that, they cry, you say, it's not provided in the budget. Let's wait for 2026.
No, you see,
that's bad faith.
No, I wouldn't call it bad faith. As I said, you inherit. How old is a government? 5 months, heading off to its 6th month, right? You take over office, and I gave you a background example of what has happened. So when you want to read a budget, you have stakeholder engagements. And these stakeholder engagements, they come out to say, okay, we all need X, Y, Z, right? It is not that government, they are all insatiable. And it's not that government is in a position to say.
The point is that this was agreed.
No, they said.
And left for government to implement.
Implement, yes.
And so when you inherit the government, you inherited this.
And we haven't thrown that away. We haven't said that we are not even going to pay at all.
So why do you now think that it's not been provided for in the budget, so wait for 2026?
No, but when you inherit something, right, and you don't have the muscle power to do it at the right time, you have to negotiate to defer.
Okay.
People take bank loans, right? At some point, they have to go back to the banks to even negotiate to have repayment conditions, among other issues.
Okay.
We are not saying this is a critical issue, right? We respect nurses, we respect healthcare workers, and there've not been any official government position insulting nurses or health workers.
That's correct.
Right? They've not been, let's put it on record, they've not been any.
Except some
explicit.
people think that inviting retired nurses is an insult.
Oh, well, you see, what I said is that, when it comes to the negotiation table with labor union, Samson, tempers may flare, strategies may be ignited, among other issues. When I told you that they were very strategic in going after the OPD, which is a very essential component of a hospital functionality, right? If a health minister says that, okay, in the spur of the moment, this is what we could consider also doing, because the government would also have to have some leverage. It's a negotiation table, right? It's not a jungle. So if they are saying that, okay, well, did they bring retired nurses? Obviously not, right? Nobody brought retired nurses.
No, they were asked to volunteer.
Right.
They obviously didn't show up.
But you see, Doc, let me just put in a little clarity, something if you permit me. You see, the OPD, as far as we are concerned, within the health sector, a very key part of our operations.
Yes.
But it is not the most critical. So usually, when these strikes are happening, you realize that the first area, which is like the low-hanging fruit, where most likely very little by way of casualties will happen, is the OPD. So kindly hold on. So usually you see that it starts with the OPD withdrawal, which offers government or the employer enough room to deal with the issues.
Which they did for 5 days.
Yes.
5 days.
Post that, then the critical areas, emergencies, as in the emergency rooms, the wards, the theaters, the ICUs are all deserted. And that is where most of the deaths will even occur.
So your point is that for the first 5 days, they should have resolved this issue.
Exactly.
Because they had not done a total withdrawal.
Yes, but you sat and got to a point where we had a total withdrawal.
I don't think...
You see, kindly hold on. You see, I have experienced these things. And I think that as a nation, we should begin to look at the way we do things. Look, for me, in as much as nobody advocates that we should have strikes in the health sector, as and when it happens, people talk about the legality or otherwise of it. I always have my view. Something knows. Maybe we'll discuss it later. However, the moment the strikes happen, if we ultimately prioritize the lives of every Ghanaian, I tell you what, we should be able to resolve the issues within 2-3 days.
Even if the strikes happen in breach of law, we should still
when you say breach of law, now let me address this. I always disagree with you because, see, the employment contract is one of service, not slavery.
That's correct.
Now, if you have a situation where government or the employer wants to hide behind so-called legalities. I'm saying so-called legalities in the sense that the very prescriptions in the Labor Act that put certain mandates on you, the employer, you refuse to do them. So that in itself is a breach of that contract from your end. However, you expect the other side to continue to function as if your breach doesn't matter. In that process, you are turning into one of slavery.
When you are building a civilized country, leaders like you, officers like nurses, must be seen to obey the law.
And that is why they will almost always engage the employer, not for days, not for weeks, but months to years. In my situation, there were times that specific issues we have dealt with the employer for at least 2 years on one single issue. So you see, it is what happens at the other side that is never brought to the fore that makes it look as if these workers end up being
I think then using the technology.
And Doc, a side comment, assessing the Labour Commission and how it works. I actually have a paper on it for my LLM. I did a paper criticizing them, the way the government hides behind them to do something. Wow. So it's not an opinion I hold, which is against the way you do
it. When you say the government hides under the Labour law, I want to believe that these commissions are independent.
They are not wholly independent.
I am saying that I want to believe.
If you appear before them, you realize that they are not wholly independent.
Well, I am saying that I want to believe that they are independent in
that's
their
what
creation.
That's what they should be.
That's the creation.
And their functionality.
No.
That's your opinion.
Yes.
So, well, when you look at it, but to use the word slavery is an extreme terminology to use in this context of discussion, because I don't think it even.
What I'm saying that if you
near slavery,
that, then you are turning it into one of slavery.
It's my turn.
Because it's been abolished. No, so do the right thing. So let it be one of service.
He's speaking a principle of law that lawyers use in labor law.
Yes.
That the contract of employment is not one of servitude.
Yes,
it's not slavery.
of service.
Yeah, of course, of service. But that's what I'm saying. But to replace that with slavery, among other issues, tend to actually put the matter in a very extreme light, which is where we are not.
So what can they look up to?
So what they look up to, we are negotiating, right? And I told you that within the negotiation table, right, or context of negotiation.
You are not. It is Parliament.
What is Parliament then? Because they refer to the committee, the health committee. No, that's not Parliament.
They made the intervention,
right? No,
it wasn't the executive.
No, government made the intervention as well. Right? When negotiations happen, it's not everything that is brought to the fore to say that this is what is happening. Right? And it is not all of the arsenal of negotiation that you put out there. But what you have as your strength, you put it on the table. And what is known to the public, you put it on the table. But as I speak with you, there's loads of negotiations ongoing behind the scenes as to how we can get this situation resolved, number one, and get restoration and normalcy within the health space. As we speak now, Closac is warming up. Right? You could hear the human sounds of that. So if you have a 5-month-old government who have had all this history, right, of, economic issues that it inherited and is trying to stabilize an economy. So what it needs to do is to, as it may, engage and say, okay, well, these are the issues. But in any case, can we, all of us sitting on the table, are we saying that we are oblivious of the fact that this was the economic trajectory we came from in the last 1-2 years? No, not at all. We came from a very overheated, boiling economy.
Are you hopeful that by 26th of June, some good news will come out rather than we hear a resumption of the strike? And at the police hospital, they told us that they saw only in 1 week, they saw over 300% increase in the number of patients who visited to access medical care.
Well, I mean, all of these increases would happen. And that's what I'm saying. These are all strategies when it comes to strike actions and negotiations. The numbers ought to be put there to know that, okay, well, we are hitting the right places or we are getting the numbers in. So when all of these negotiations happen, we need to rather contextualize rather than weaponize them as political tools to use to disarm political opponents or to make political capital out of it. When we do that, we all lose sight of the fact. This is not the first time nurses are going on strike under a particular government. Different governments would come and go. So let's look at it. When we say we are resetting, we are looking at it from a national perspective, a holistic perspective.
Okay.
So for me, my appeal on this table and beyond is that can we have that engagement devoid, right, of weaponizing terminologies, you deploying them in political, armory style, trying to justify cases or make a government look bad. No. We have come a long way as far as the economy is concerned. Let's rally together to see how we can put a sustainable measure to this.
How do you suggest government takes full advantage of this temporary, halt in the strike?
Well,
because it got to crisis points, really.
Yes, indeed. As a non-politician, as a non-trade unionist, I would say that my views on this would be limited, except to say that I think what's critical is the dialogue. What's critical is to have a meaningful conversation. I could sympathize with our brother, the vice president of the Nurses Association,
Samuel,
saying that if you go to meet with the minister and at the end of the day, all that happens is that, trust me, you cannot go back to your members and say, well, the minister says we should trust him. I think
they will accuse you of even,
exactly.
Getting some kicks.
Exactly. I think it's about having a meaningful dialogue. The government cannot absorb a 2 billion budget, but what can it afford? I don't think it should be, it's either a 2 billion or nothing. They say 160 liters of fuel every month. What can the government afford? They say, well, 1,000 cedis annual uniform allowance. The government cannot. What can it afford? I don't think it should be what you want or zero. And
payment for their renewal of their licenses.
Payment for the renewal of their licenses.
Some say they shouldn't be demanding that because that's what makes them, nurses in the first place. And I was just mentioning to a friend that my colleague lawyers who are in government, when we are paying for our renewals, it gets paid for them. Accountants, it gets paid for them. So why not?
Yeah, exactly. So
license for them.
Yeah, that's what I'm saying.
Samson, the irony of it, in the case of doctors, for a hospital to get a license, a doctor's license should be part of the application. Why should I pay for my license as a private practitioner or as a private person, a doctor, to practice my profession? And when my institution wants to get its licensing done, my license is the one that will be
okay.
used in the process. Let's be fair. There are a lot of things in the general public sector.
You use same license for locum?
No, what I'm saying is that without...
No, I'm asking if you use same license for other locum activities.
No, hold on. What I'm saying is that...
And locum is the extra work they do privately.
And they can choose to spend it anywhere they want.
But like something said, if a lawyer in the public service gets his license renewed for by the organization or the state,
accountants, all of them,
and they also
auditors,
offer some sort of legal services to all other persons aside government. Let's be honest with ourselves. Then you realize there is some unfairness. You see, a lot of things have happened in the space, and there are a lot of inequities that we need to resolve. But for me, the key thing is that at any given point, when you agree on a set of conditions for a group of professionals, please do your best to manage them. Look, I don't think the nurses will say that if you don't implement all the conditions at a go, we will never go back to work.
Okay, so you have come back to Sule's point. Sule, that's where you were.
I support what Sule is saying.
Sule, that's where you were.
There are no hanging fruits.
As for the license, the justification is that I'm renewing the license to work for you.
Yeah.
So what's the point?
Exactly.
Pay for it.
I think that it's important for government to look at what could be possible within their demands.
All right.
Rather than making it sound as if, well, wait for 2026. Everything should be on hold until 2026. I think we've all come to the point where we realize that there are a lot of inequities, as Dr. Yankson is saying. Somebody could be a nurse, would have been a registered nurse with these same conditions that they are fighting for. But because he or she is a politician, gets appointed onto a certain position, and all of a sudden, the person is getting like 10 times whatever,
80 times,
or 20 times whatever the person is earning. Not on the basis that he's acquired a different qualification or a different experience or whatever it is, but the only thing is that he or she is a politician and has gotten the favor of the president for an appointment. And it happens everywhere.
And they may retire on that salary.
Exactly. And so if we're talking about a situation where, yes, we all appreciate the difficulties within the economy.
Right.
That is true.
Everyone is looking at me.
We all appreciate the fact that we cannot be treating our nurses and doctors the same way as doctors and nurses in the UK or the US are being treated. But what is fair should be done.
But do you appreciate the point they make that, Justice, I didn't believe that was true until I recall that you sat on this show and spoke about a similar situation, that when they are sick, they are not catered for?
Look, something, until about, let's say, a couple of years back, practically nobody caters for anybody. Today, when I am sick, I don't even bother myself. I make sure I look for cure for myself. You know why? On paper, some of these conditions that they are fighting about, it's in there that take care of me. However, at the point where you are sick, I tell you what, if you don't take the bull by the horn and find a way to survive, most times that support from the employer will never come. We have doctors who work for the government. There are times that the GRNMA has to mobilize funds to support them.
Yeah, I've heard those stories.
Sometimes we've had to appeal to government just to come in. So even where you have something on paper, in practice, it doesn't work.
Okay.
Let me just would help with the equity aspect and synchronization of it from a very honest perspective. There is a legacy issue within our public administrative space that we ought to look at, regardless of politics and regardless of position, even within public and civil service.
What do you mean, legacy?
When I say a legacy issue, there's a template of a conditions of service that goes to possibly to a civil or a public servant or a politician or what have you. It lists a litany of issues. A gardener, a blah, 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 blah.
But we don't get it in the house.
No, I'm just coming. I'm not saying, it say a list. I'm giving a broader example, right? You could receive this letter, Samson, and it is not as it is. But because that template, that's why I use the word legacy, because that template exists, if anyone gets hold of such a condition, they would erroneously think that you are getting all of this, or you, yes, much as you may be entitled to it because it's a legacy issue.
Okay,
so I think that there have to be a certain overhaul of conditions of service to public civil servants and essential service workers, and streamline it within market rates to reflect all of this.
Thank you. Thank you, Sule. So it's okay. I'm sorry. Let's hear Sule now. Let's hear Sule finish his point
so
now.
If I may conclude by just starting from where Dr. Rashid just talked about in terms of what is on paper and what may be the realities. I think, yes, you're right, but in some instances, what you see on paper is what is the reality.
I agree with that too.
You know, and so if it can be done with certain positions, why can it not be done for all? Yeah. But let me conclude by saying that what Dr. Yankson is saying is true. I'm not a doctor, and so I wouldn't expect that maybe whatever is on paper for him extends to me. But I think what he is saying, which we should emphasize, is the fact that our medical sector or our health sector itself is sick. And the health sector itself needs cure. Let's at some point, I think the conversation should transcend beyond, whether nurses are going on strike or doctors are going on strike and so on and so forth. But the entire system is sick.
Okay.
It's not about doctors who cannot, get the best of treatment, within the facilities. It applies to everyone. Okay. If you have a good friend in the medical field, they will tell you.
I get very quick comment from Mary Awalanada. Eraba says that they call them essential services. It means we should be proactive in handling their issues. But sometimes they hold us hostage, and we should, when they hold us to ransom, we should say it because they are using their power. Elsewhere, people will trade their degrees just to be a nurse because of the good treatment they receive from their employers. Government is spending carelessly. They should prioritize. Mary, quick comment on the nurses. What do you say? So that 26 June, we don't hear them say it didn't work. Should we even wait until 26 June? Hello, Mary, unmute your mic.
I am unmuted. Can you hear me?
Yes, please.
Great. So thank you, Samson. Good morning to you and the other panelists. I would want to say that government should not at all wait for the 26th. They should, as a matter of urgency, look at what can be done in the interim to ensure that this impasse is resolved as quickly as possible. I say so based on the fact that, for me, I think this was very unnecessary. Other interest groups or other labor unions who had issues were engaged and they had their requests met. I cite, for instance, the youth tag, which the president has mentioned recently on some of the things the budget did for them. And so for us to say these are essential services, it means that, as my brother Samuel indicated earlier, it means we need to be able to pay attention to them. Because as we say, the wealth of the nation is in the health of its people. And so if the people are not healthy, we are not able to do as much as we would want to do. Again, if some of us get sick, and during the week I saw pictures on both Joy and other television stations which show the desperation of some of the people of Ghana because these services were withdrawn. Those who were working were not able to do this. So let's see how government can do this as quickly as possible. Remember, even for some of us who work in the small spaces, these type of negotiations can be very intense and they can take time. But I believe that it's gone past that. They have agreed. And so if governments have agreed, and we all say that governments are continuums, and we all also agree that these negotiations must be met then government should not waste time. And I say so based on the president's research agenda, which has so far done a lot of good to promote some of us our trust in the fact that our current president and government are willing to live above board to show that they really care about the people of Ghana. And we know what inflation has done to some of the conditions. And many of you have indicated some of the demands are not above board. They are within the space. For a whole year, if you are giving a next 1,000 cedis for uniform allowance, I don't think it's too much. If we are paying their licensing fees, I don't think it's too much. And others have mentioned that many the professional bodies have this catered for, even to the Institute of Directors. And if you check that manual, it says some of these things. So let's not waste too much time discussing this issue. It is without a doubt that every Ghanaian worker living everywhere demands the best treatment to be able to give out their best. And when these issues are not beyond government, then I believe government should act so that the goodwill it is currently enjoying would continue to be observed. I believe we shouldn't be distracted at all with these issues. And I also hope that my brother's group, Samuel's group, the Ghana Registered Nurses and Midwifery Association, would not demand that 100% is done, but some graduation agreement on what can be done now and what can be taken into the future, I believe would suffice for now.
Thank you very much. That's very succinct, straight to the point. Is someone still on the line? Okay.
Yes, I'm on the line.
The final word to you in 2 minutes. Are you ready to make compromises so that government can meet you perhaps halfway?
I think we have done that. And when I started my presentation, I stated that clearly, that we've taken off all the arrears that government would have paid from July 2024 to date. And we want to start afresh and move forward. The understanding we got at the meeting, we believe, we actually presented that to our council. It was not easy for us, but we also made them to understand that we have to relax a bit and get something small, and then 2026, the rest can be dealt with. Again, we are almost approaching another season of negotiation. So we plead. I don't just want to even think of us resuming any industrial actions, because we have given enough considerations and we expect that government should look at it and deal with it so that we can all sleep. Thank you.
Thank you very much. Thank you very much. Please do.
You know, there is this erroneous impression, comparison to say elsewhere, these nurses are being treated right. We want our nurses to be treated right. But if you look at it, let's take the UK, for example. A Band 5 nurse earns about 24 to 25,000 pounds per annum. That is woefully inadequate. What happens is that locum services and other bank works allow them to accumulate extra income out of the basic salary they get. And this sometimes tends to paint a picture as though this is what is happening out there in Europe or America or elsewhere.
Okay.
In London, an F1, a Foundation 1 medical doctor can even rent a 1-bed apartment. Right?
Okay.
They come cumulatively to rent a house and live in
Thank
homes.
you very much.
So it tells you that, yes, we are doing our best as a nation to actually
this will be where, sorry, gentlemen.
Arab countries.
Yeah.
So just giving it. But so what I'm saying,
and let it look as
I'm not looking, but that's what people are saying. An example, but we're trying to get a broader stream.
This has nothing to do with you.
Why not you only a government that has reneged its obligation to meet its side of a simple bargain that was never.
Thank you very much. Frank Anderson Jr. says, I'm probably naive, but would it be prudent to opt for a court to compel the employer to honor their contractual obligations to the nurses? In fairness, strike in the first 6 months of a new administration with a literally bankrupt economy may be seen as bad faith. We all need to be adults and manage our expectations. That said, the government also needs to engage positively and transparently. My guests who have been doing the discussion so far, Sharif Mahmood Khalid, those of you who came on social media and said, where is his title? We insist, put the title there. You heard him. He said he doesn't even want it. He's economic advisor to the Vice President, Andrew Ejapa-Mensah, is lawyer, former member of parliament for Second D, former minister, deputy in 2 portfolios. Dr. Jackson Yansing is lawyer, former general secretary of the GRNMA. Suleiman Ibrahima with the Media Foundation for West Africa. He's executive director. Of course, they are the ones behind the commencement processes. They blew the whistle on the almost 82,000 ghost names that have led the Attorney General to uncover corruption in excess of 500 million Ghana cedis, for which 12 people and 9 vendors are being held. Samuel Alakora Akolgo is first vice president of the Ghana Registered Nurses and Midwives Association of Ghana, and Mary Awolana Ada is executive director, Transparency International Ghana. We'll be right back to deal with the questions of the prosecution that is pending.